Good morning, and thank you for creating time for us. In case you're just joining us, we are just crossing over into the second interview that we had lined up for you today. But if you have created time to join us on this show since we started at 6 a.m. in the morning, we really appreciate your company, and we continue. So we usually every Wednesday talk about matters health and lifestyle, and this particular Wednesday we want to talk about fibroids among women, something that has been considered quite common, especially among the women who are of the childbearing age. Some are considered normal. They would say you'll have your normal life, nothing to worry about, nothing to be concerned about. Some would not even know that they have fibroids in the first place. But in other instances, it can get so bad and present some complications that we're going to be talking about here with Daktari. When should you be concerned? Are there options for you? What are you supposed to do, especially if you have fibroids that are actually not very comfortable and they're affecting your day-to-day life? So be with us beginning right now till the tail end, but allow me now to introduce Daktari. This morning we are hosting Dr. Buckley Onyambu. He's from the Nairobi Hospital. He's a consultant obstetrician and gynecologist, and also laparoscopic surgeon. That was a mouthful for me. Karibu sana.
Thank you very much, Sabine. Thank you very much.
We appreciate your time this morning. You know, when you say fibroids, quite common. Women would say it's something that has been normalized.
Yes.
But when you come to think of it, not so many of us know so much about it or even know what we should know about it. So that's why we're having this sit down this morning, just to break it down and make it easy for our viewers. And we begin from the very basic, Daktari. Explain to us, when we talk about fibroids, what exactly are we looking at?
Yes. Fibroids are growths that occur in the womb, or what we call the uterus. They are the commonest non-cancerous growths that occur in the womb, and they affect in our region close to about a third of the women who are within their reproductive age group. In fact, generally speaking, by the time a woman is turning 50, in our area, she has about an 80% chance of having one fibroid or many fibroids. 80%? 80% chance of having one fibroid. But of all those women who have fibroids, it's only about 30% that will have problems because of the fibroids, will have symptoms because of the fibroids. The greater majority of the women will have fibroids, but they will have no symptoms at all, and they can live comfortably with them. And this is generally what fibroids are. They're not cancerous.
And the underlying non-cancerous. Because every time you talk about growth, you talk about tumors, there's that areole that just goes up. Like it could be cancerous, it could be something that I should be concerned about. So underline the word non-cancerous.
Non-cancerous. And actually they're just one of the many other non-cancerous conditions that can affect the womb in a woman, or the reproductive system in a woman. There are many, many other conditions that are non-cancerous, and fibroids is one of them. But having said that, it's not that they do not have a disease burden amongst women. They indeed do have a heavy disease burden amongst women, and they're probably the commonest reason why women would seek consultation with an obstetrician gynecologist, alongside other problems like difficulties in conception, and now increasingly endometriosis and other non-cancerous conditions, or other non-infective conditions also that afflict women.
All right, we'll talk about those complications as we continue having this conversation. But I want us to look at the types of fibroids, and you can even choose to go the direction of where they're located, so that we can be able to have a clear picture on, you know, the different types.
Yeah, thanks, Afin. That's a good question, because actually the types of fibroids would largely determine whether they do or do not cause problems.
All right.
And we actually try to classify fibroids according to the location. And that's really the scientific way of classifying fibroids. And the big organization that tries to create the terminologies for fibroids has given us about 7 classes. But all these classes are based upon the anatomy of the womb. And basically, if you look at this as the womb,
you can just feel free to hold it up.
Yes, if you look at this as the womb, there are 3 basic spaces in the womb. you have this space inside, and this is called the endometrium. And this is a very delicate lining that responds to hormones, and it's the one that sheds off as periods at the end of every cycle.
Every month, yeah.
And then we have the middle part, which is in this model in red color. And that is really the muscle part of the womb, and it's designed that way so that at birth it's able to push the baby out.
Right.
And this is really a muscle. It's made of a type of muscle we call smooth muscle. And this muscle is called the myometrium in medical terms, really. Then we have a thin outer surface on the outer part, which is really the encasing of the womb. And this encasing also encases almost all other organs that occur in the abdomen. But in this particular site, it's just called the serosa, or the outside of the womb. So you can have fibroids that almost are entirely located inside the womb. And those we call type 0 fibroids or submucous fibroids. Those are quite problematic because, as you can imagine, they're located in an area that is going to shed as periods.
Yeah.
And they're located in an area that the baby is supposed to be growing in.
Yeah.
So these are the ones that tend to cause most of the symptoms.
The complications.
The ones that are completely located inside. But then you can also have fibroids that are partly located inside and partly in the muscle. For those ones that are located partly inside the inner lining and partly in the muscle, again, we divide those into two. And then we have those that are largely inside and those that are largely outside. And those we call type 1 and type 2. And then
so you have type 0,
type 1 and type 2. And then you can have one that is just located inside the muscle itself, but just touching the inner lining. It doesn't indent the inner lining of the womb. It's just located and just touching the inner lining without indenting it. And that would be our type 4. And then we have another type now that is going to be located just inside the muscle without touching the outside and the inner lining.
So it's kind of in the middle.
It's just in the middle there. And that's going to be our type 5.
All right.
And then they're going to have two types now, 6 and 7. Again, they are located on the serosa, the outer lining that I mentioned. And again, they're labeled type 6 and 7, depending on whether the larger part is on the outside or inside. Right. Then, of course, there's a type that is just hanging out, which we've not classified. It's just hanging out. It develops, fibroids can develop a stalk and hang out. And sometimes even those ones that develop a stalk can hang out, and the stalk that is here dies, and the fibroid develops another source of blood supply. Those we call parasitic fibroids. So again, the symptoms that they cause really depend on
where they are.
You can, yes.
But just out of curiosity, the farther they are from the womb, the less complicated they are, or?
Generally speaking.
Am I right? Okay.
Generally speaking. But some of them can cause quite some substantial problems. For instance, those parasitic fibroids I'm talking about can be located in an area of a delicate organ like the tube that brings urine from the kidney to the bladder. And if they're compressing on the ureter, that tube is called the ureter. If they're compressing on that tube, you know, they're going to block the flow of urine from the kidney to the bladder. And then, of course, now they cause problems on the backside of the backflow of the urine into the bladder, and those problems tend to be more severe. So really, fibroids are a major disease burden amongst women. But as you're right, by saying that generally speaking, the farther they are from the inner lining, the less likely they are to cause problems.
That is if your goal is trying to have a baby.
Especially, yes.
But of course, like you're saying, it can bring other complications as well, just that can make somebody uncomfortable, whether you're trying to have a baby or not.
Correct.
Yeah, yes. Depending on the location and all that. We'll talk about how you categorize them in terms of size, what is large, what is medium, what is small. But then before we get to that point, because you had already started mentioning difficulty in somebody going to maybe for a short call, talk to us about other symptoms that present when it comes to somebody who has fibroids. Do we have, things that can act sort of like telltale signs that there could be a problem?
Yes, I think there are 5 main symptoms that fibroids can cause. One is heavy periods, and that is one of the telltale signs. If the periods are heavy and there is bleeding also in between the periods, one needs to have a check and see for the possibility of fibroids. There are many other causes, of course, for heavy periods, but fibroid is one of them. The other problem that fibroids can cause is pain. And the pain may be with or without periods. Again, pain in the lower abdomen, especially if it is associated with your menstrual flow, then this kind of pain needs to be checked. It could be because of fibroids. The other one you already mentioned, that fibroids can cause difficulty in conceiving. You may find people who have fibroids like the type that I mentioned that are growing within the cavity of the womb, and those types tend to cause difficulty in conceiving. And again, as you mentioned, you may find that fibroids, because of their sheer size and growth, may cause compression of other structures that are next to it. You know, when you have the uterus, right in front of the uterus is the urinary bladder.
Yes.
And behind the uterus, you have the rectum. The rectum is the storage for stool before it is finally passed in the toilet at an appropriate time. So if fibroids are growing backwards, then they're going to be causing pressure on the rectum. And one may show up with problems with defecation or passing stool. One may show up with problems with the frequency of passing urine because the fibroids have grown big and they're compressing on the bladder. And then you may find fibroids...
So it depends towards the front side or the back side? So it depends?
It depends on the direction in which they're growing. Those are some of the symptoms they can cause. One of the other symptoms that they can cause is anemia. Because of the heavy bleeding, and then you have low blood levels in the body. And in many instances, women have been sent to me having presented with symptoms of a heart problem, only to be found to be very anemic, and then their doctor sends them for a removal or check of the fibroids. I had one patient who was sent to me, and we did operate on her recently by an orthopedic surgeon. And the lady presented, the symptom was pain in the leg. And when the orthopedic surgeon checked that pain, it was actually a clot that had formed in the leg. And the lady had not known that she had very large uterine fibroids that were compressing on the blood vessels that are coming from the legs. And because of that compression and stasis or slow movement of blood, she had developed a clot in the leg.
So,
yeah, so
if you go to the wrong facility, then you can get a misdiagnosis.
Yes, that is the fact.
Because how do you relate your legs with, having fibroids?
Exactly, yes.
Yeah? Or the heart problem with having fibroids.
Yes.
So if you go to the wrong place, you may just end up getting a misdiagnosis, and you may end up living with this complication for years.
That's true.
Doc, I also read somewhere that, the way we are in this era where women are very concerned about having a flat tummy and looking all nice, that in certain instances, a fibroid can grow so big and become sort of almost like a pregnancy.
Oh yes.
Yeah?
Oh yes, these never-ending pregnancies, as women call them. And one of the problems fibroid causes is that because these ladies have a big uterus, they are looking like perpetually pregnant, and everywhere they go, because some of them have been having difficulty in conceiving, and they go to the office, and everywhere they go, people are saying congratulations, congratulations. And that's really emotionally a burden. And
insensitive.
It's insensitive. It's a burden because, the lady doesn't know how to react to it, whether to take the congratulations, or most of them just say, thank you, thank you. But inside, of course, they are really burning. It's a heavy burden because they have these growths. And unfortunately, some of them don't even know that they have those fibroids. They're trying to conceive. They have difficulty in conceiving. And yet people are telling them congratulations. And yes, you're right, Safin, that some of them can grow so big.
To the size of a growing baby in the womb.
Yes.
So now that you've gotten to that point, let's talk about the classification in terms of size. Sometimes you go to the hospital, you're told 3 centimeter fibroids, 2 centimeter, 5 centimeter. Okay, break down that for us in terms of what is considered small, medium, large, and in what category should one be concerned?
Yes, I think that we call it fibroid mapping. And that fibroid mapping is done mainly for treatment purposes.
All right.
But in no way does it have a lot of significance in terms of symptoms. And when we classify fibroids in terms of sizes of different fibroids, we also classify them in terms of location. In fact, clinically speaking, location may be more important than size.
Than even the size?
Than the size.
Okay.
Because you can have very large fibroids, close to even 2-3 kilogram fibroids, without any symptoms at all, depending on where they are located. And you can have very small fibroids, 1 centimeter fibroids, and if they are located in a sensitive place, they will have more symptoms. Yes, we do classify fibroids in terms of size. Again, that helps the clinician to plan the treatment and also to offer alternatives for treatment. That's really the purpose of looking at fibroids in terms of size, because then it helps me to decide which is the best route that I can use to treat. If the fibroids are causing symptoms, which is the best route I can use to approach these fibroids in terms of treatment. So it's really not an adhered to classification to most people, to people who have fibroids, but it benefits the clinicians. When you're doing a fibroid mapping and mapping them in terms of size and location, it benefits the clinicians to plan the treatment for those fibroids.
All right. I like the fact that you're saying treatment, so it means there is hope, yeah?
Yes.
So before we end this program, we'll be able to also explore the treatment options and what is considered in choosing one over the other.
Yeah.
But let's explore some science or biology a little bit, Daktari.
Yes.
When you say it is common among women of childbearing age, explain to us the concept. Why women of childbearing age?
Yeah, what causes fibroids? I think that is not understood very well, because I hear you asking me what is the reason women have fibroids, what causes them, and why
especially women of
why in that particular age. Yeah, I'll come to that. Let me begin there. Why women of childbearing is one of the postulated mechanisms of causation of fibroids is hormonal. Yeah, we know that there are 2 dominant hormones in women in their reproductive system. One is estrogen and the other is progesterone. Particularly the hormone called estradiol is thought to propagate the growth of fibroids when they do occur. These are changes that are happening in the smooth muscle of the fibroid, and it's thought that part of the reason they occur is the hormones. Women of childbearing age have the highest levels of estradiol and progesterone. And it's even been shown that Africans, and it's actually a fact that Africans are more likely, 3 to 4 times more likely, or people of dark skin are 3 times more likely to get fibroids than Caucasians or Asians. In fact, Asians have the least prevalence of fibroids. If you take women of reproductive age, in women of reproductive age of dark color, the likelihood of getting fibroids is about 25 to 30%, as I mentioned earlier. But if you go to the Caucasians, it's only about 7.5% in the Caucasians. If you go to the Asians, especially the Far East Asians, you're talking about 5 to 6% of them in the general population of women of reproductive age getting fibroids.
I'm about to ask, what does skin color have anything to do with?
I probably, 2 things.
Yeah.
And these are things that people are thinking about now more. I'll give you, and now we are talking about still the causes of fibroids. One, the genetics. There is a gene, I think they call it MED12, that is thought to be correlated with the causation of fibroids. And this is found predominantly in people of dark skin. But the other thing that is very interesting and now is emanating is vitamin D. Vitamin D has a very strong correlation with fibroids now. Low levels of vitamin D. And it is interesting and paradoxical that people of dark color tend to have a higher prevalence of vitamin D deficiency than people of light skin color. So there's an interesting correlation there, that low levels of vitamin D tend to happen more in people of dark color than the light-skinned people. And it's been correlated that low levels of vitamin D may have a role to play in the cause of fibroids. And vitamin D has a very important role to play also in the immunity of an individual, you know, in body protection from infections and harmful substances. Even the changes, natural changes that occur in our body cells, that the body detects and destroys those cells. You know, the body is always changing its cells. They're dividing on all parts of the body. And the body sometimes, or rather always, has a mechanism of detecting abnormally changing cells and destroying them. We know that in that immunological mechanism, vitamin D has a huge role to play to enable your body have good immunity. And it could be, and this is really a postulation, that these changes that are occurring in the muscle of the fibroid, because the immunity is affected by low levels of vitamin D, are not detected and those cells are not destroyed. And therefore they continue to grow to become fibroids. So it's possible, and people are looking into these areas of low levels of vitamin B. That could be a possibility why dark-skinned people tend to get fibroids more than the light-skinned people. And again, we know that inflammation, soreness of the body, or the body's reaction to anything that is abnormal, whether it's coming from the external or internally, contributes to the causation of fibroids. Again, you see the immunological mechanism again working in that area to contribute to the causation of fibroids.
All right. Quite an irony, because we thought Africans or dark-skinned people were actually strong and tough, and because of the circumstances under which we live in and operate in, our immune system naturally just becomes very strong. But it's a good point you raised there, quite something that you know, can help us connect the dots and observe a trend that we need to pick up when it comes to how these cases surge. And I also want us to talk about, do we have any other causes that we can speak about, or anything that somebody who's watching us could start observing or avoiding in terms of change of lifestyle or whatever, that can actually lower the risk?
Yeah, you hit it.
That
is it. Lifestyle, you hit it. And now fibroids are correlated very much to lifestyle, particularly obesity. We know that these hormones, we call them cholesterol-derived hormones, have a huge contribution to make on the appearance or prevalence of fibroids. So lifestyle. And you know, the 8 elements of lifestyle, I don't want to go into that. If you invite me on another show, I will actually, it's a topic I love very much.
All right.
And I would talk to you about the 8 elements of lifestyle. But basically, the nutrition somebody takes, the food they take, their exercise program, their fluid intake, vitamin D, sunlight that we have talked about, avoidance of harmful substances to the body, clean, fresh air, proper circadian rhythm observance, that is sleep and rest, very important things, and stress management, all things that contribute to your lifestyle. Those are the basic pillars of a lifestyle. And it's been shown that a poor lifestyle, a lifestyle that is let me put it this way, as I put it, a lifestyle that does not give one good quality blood. A lifestyle that does not improve the quality of your blood, because therein lies the secret. A lifestyle that does not improve the quality of the blood will contribute to many other illnesses, among them fibroids.
It's not just a lifestyle that does not improve the quality of your blood. You heard that.
That's it. If there is a take-home message, it's that. It could be
something you eat. It could be just generally how you live, exercise to allow the blood to flow very well in your system, rest, avoid stress. Hey, Doctor, I'll call you for that.
I'll be more than willing to come, and give me 2 hours to discuss that one.
2 hours?
Yes.
Okay, so let's talk about the instance where, because you've talked about symptoms and signs, do all women who have fibroids experience this, or there are certain instances where some women can just continue with their normal life without even knowing what is happening within?
In fact, the majority of women will have fibroids without symptoms. The majority of them. And not all fibroids need be treated. Yeah, the majority of them is just to observe them and maybe make an annual visit or 6-monthly visit to the doctor, just to observe whether there are any changes occurring in size and location of those fibroids, or in number also of those fibroids. So this is the great majority of women, probably 70% of the women in our black population will live with fibroids without any problems. It's only, and fibroids need only be attended to if they are causing a problem. If not, we just leave them alone.
Be. So let's talk about those that are causing problems, yeah? Because that is the biggest concern. No wonder we are having this conversation this morning. So what are these problems that somebody should anticipate, or that women are experiencing out there as a result of fibroids? The most common ones.
I'll just talk about the two commonest ones that women experience. One is heavy menstrual flow. And the second one is difficulty in conception. These are the biggest problems. Thirdly, you may get pain. Pain is also, pain with periods or without periods is also a symptom that in our community affects fibroids. And then occasionally, one may get just aesthetic problems, because the fibroids are very large, they're disfiguring, people can't put on the clothes that they want to wear, or they're outgrowing the clothes that they were wearing, and it causes emotional problems, and that's a heavy thing. Sometimes can even lead to mental problems. I've had a patient actually who had almost a 9-month pregnancy-sized fibroids for a long time. And
you will try to exercise, and that tummy is not going away, and you're asking yourself, Dr. that is important. You should stress on that.
Yes.
That there's a woman who you just feel like you're full. It's like you're pregnant, but you really don't know where this is coming from. You've been carrying this belly for so long, and you don't even understand why it's not going away. You've tried exercises, you've tried all sorts of things to be able to get that flat tummy that everyone wants, but you're not getting it. It's one reason why you should book an appointment and get it checked, right?
Absolutely. In fact, I'm laughing because quite a number of times I have seen women in my office in Nairobi Hospital where they're saying that I was sent to you by my gym instructor. Many times, not once, not twice, many times, that my gym instructor is the one who was doing stretches on me, and he said, maybe you need to go and see your gynecologist because your belly is not going away, and felt a hard mass around it. So it's true that some women are working out their bodies in the gym, expecting the tummy to go away, yet there could be an underlying growth below the tummy.
And we're not saying that all tummies are fibroids.
Yes.
We're just saying go get it checked so that you can be told what it is, right?
Yes.
Let's talk about fibroids and fertility and pregnancy. That is also a huge concern, how this relate and how, what impact fibroids have. Let's begin with those who are trying for a baby and what risks it presents if somebody discovers, maybe they've gone for their first scan and they discover they have a fibroid.
Yeah, two things. One, let's talk about it in terms of natural conception, and I will also talk about it in terms of artificial, ART, assisted reproductive technology, where IVF is one of them. In terms of natural conception, and as I said, a big number of women who have fibroids will continue to conceive naturally. But the fibroids that are particularly occurring within the inner lining or indenting the inner lining of the uterus are likely to cause problems with both getting pregnant and miscarriages. So it's that dual role, both in terms of getting pregnant and the incidence of miscarriages. And sometimes the fibroid can be missed. You may find a small fibroid less than 0.5 centimeter that is occurring within the inner lining of the womb, and it's contributing to recurrent miscarriages. But it has also been demonstrated that fibroids, even if they're not occurring in the inner lining of the uterus, and they're occurring in the muscle itself. Remember those types that I talked about earlier on? And they're occurring in the muscle itself. Or even sometimes the ones that are just touching the outer surface of the uterus, the one we call the serosa, even those have been demonstrated to contribute to difficulty in getting pregnancy and miscarriages. Same goes for assisted reproductive technology, that whatever one tries, either the tubes are blocked or they have a problem with the ovaries, and that is the reason why they are not getting pregnant. And that sometimes, even in those women, who are going for assisted reproductive technology, fibroids can be responsible for failure of IVF, for instance, if they are not checked and removed.
And
so sometimes
IVF is expensive.
Yes.
You can imagine if that limits your chances.
Yes.
So let's talk about how it prevents, especially conception. How does it?
One of the ways we use to help women who do not want to conceive, not to conceive, is an intrauterine contraceptive device. We know that if you place anything within the cavity of the womb, and this came about by long distance travelers. Those days they used to use camels in caravans. They discovered that if they put a stone in the womb of the camel would not get pregnant in the long distance travel, so they would carry their goods. So this was developed by and by over the ages to the intrauterine contraceptive device, the coil. So if you put it in the womb, it's able to prevent a pregnancy. Same mechanism. If a fibroid is growing in the cavity in the womb, that is one of the mechanisms that it uses to prevent a pregnancy, because it's like something that has been placed inside the cavity of the womb. The other mechanism, of course, is that when fibroids occur outside, there is a reaction, there is an inflammatory reaction, or there's a body protection reaction that is occurring around the fibroid, and that itself may affect the pregnancy or prevent the pregnancy from happening. And then also there is an alteration. If the fibroid is occurring in the muscle or close to the inner lining of the uterus, there is an alteration in the blood flow because there is a growth there. And fibroids usually don't have a lot of blood flowing into them, and that may alter the blood flow into that area, and therefore the nourishment of the endometrium when a pregnancy implants or even before it implants, that affect the pregnancy. So there are many mechanisms around which fibroids are able to cause.
And in instances where there's already a baby that is growing in there, and then the patient is told that the fibroid is increasing in size suddenly. What's the biology behind that as well?
It's a good question you ask, Safin, because there are two ways to look at these fibroids coexisting with a pregnancy. And one is how does the pregnancy affect the fibroid? And the other, of course, is the reverse. How does the fibroid affect the pregnancy? So there are two ways to look at that question that you're asking. One is how does the fibroid affect the pregnancy? We know that most fibroids can coexist with a pregnancy up till 9 months without a problem. That's a general statement I would make. But occasionally you may find that fibroids may weaken, especially if they are located in the lower part of the womb, the cervix. They may weaken that part and cause opening of the cervix in advance of 9 months or before the pregnancy is mature and lead to miscarriages. We know that fibroids can also cause, and this is how pregnancy affects fibroids, and in turn fibroids affect pregnancy. Fibroids can cause inflammation or soreness of the womb, because during pregnancy, the womb changes. It's not just changing in size and growing big, it's also changing in terms of its blood flow. There's a lot of blood flow that goes on there. There are a lot of hormones that are being secreted by the placenta that is there. And these hormones, one of them is estrogen and progesterone, as I alluded to earlier. These cause the fibroids to be nourished and to start growing very big. In fact, the fibroids start growing much faster than their blood supply. And what happens to the fibroid when it's growing faster than its blood supply can cope? The center of that fibroid begins to quote-unquote die. And that change causes pain and causes inflammation around that. And that's how pregnancy also affects a fibroid, that it can cause fibroids to degenerate. That's the term we use. And they become very painful, and they become sometimes so painful, maybe around 20-24 weeks of pregnancy, that you have to admit a pregnant mother into the hospital just to manage the pain. Yes.
So those are some of the instances, of course, and like what you said earlier, it doesn't necessarily mean that it can get to that situation, that there are cases where the fibroid can coexist with the baby and the mother will still have a safe delivery, but there are cases where there could be complications that also need to be checked. And I want us to, at this point, just talk about the the treatment now.
Yeah.
Let's assume now you've already made your diagnosis and you see this is a case that needs treatment. And I just want us to talk about, first of all, what the patient should expect when they come for this appointment. How do you do the diagnosis? And then later you can run us through the treatment options and what you consider to choose this one over this one.
Yeah. To confirm fibroids, the history and what we have alluded to, the symptoms have to be elucidated by the physician. He has to listen carefully. And then if they are very big on examination, one will just actually feel the irregular shape of the uterus, especially if one does an internal check and checks the womb between the fingers and the hand, you'll be able to feel the irregularity of the shape of the uterus and suspect that they are fibroids. Imaging is, of course, the gold standard in confirming and, of course, staging or classifying the fibroids. And there are various imaging. The easiest and probably the most affordable imaging one can use is ultrasound. The ultrasound can give you, if you have a good ultrasound scan, both done internally and also externally from the abdomen, one can be able to locate a majority of the fibroids. And now in terms of actual treatment, there are many options that one would take to. There are surgical options and there are medical options that one would go into. So in terms of the surgical options, the commonest, let me not put them in preference. Let me say the ones that is commonly used here is open surgery.
No, you say surgery.
Yes.
You scare people.
Yes.
Yeah. So talk to us about that type of surgery and how it's done. Is it a major? Is it a minor? Is it invasive? Just for somebody to have a clear picture of what really to expect.
Yes, to remove. Yeah, the target of the surgery, and this again I must emphasize, is for those fibroids that are causing problems.
Yeah, the problematic.
The problematic fibroids, not just all fibroids. For those fibroids that are causing problems, any surgery that involves entry into the abdomen is classified as major surgery. We can either use an open technique, and when I say open technique, is where an incision is made on the abdomen and the womb, the uterus, is exposed to the outside. And then the surgeon either removes specifically the fibroids themselves, or if the patient does not have a desire to have children and the fibroids are causing severe symptoms, the entire womb can be removed, leaving behind the ovaries. But there are newer techniques now, and they do not apply to all types of fibroids. There are newer techniques that are surgical still that can be used for some types of fibroids. And these include minimally invasive surgery. Yeah, and in minimally invasive surgery, also called laparoscopic surgery, the technique is to avoid the large incision that is made on the skin and yet achieve the same procedure. That's basically the difference. You want to avoid the large incision because of the complications that may arise because of a large incision, but you want to achieve better or even the same kind of procedure that you would do with an open technique in terms of
so your goal is still to remove the fibroid.
Correct.
But what you're doing now is the incision is not as large as it was previously done.
Yes.
Yeah. So this is like something that is coming up, a modern sort of
way of doing it. Yeah, it's been around for a while now.
Yeah.
But what I'd say is that it's in our region is something that is being perfected. We've probably gotten to world standards in terms of this kind of approach to removing of the fibroids. There are newer surgical techniques that are coming up, and one is because these fibroids also depend upon blood supply to grow. And you can actually deny them the blood supply by blocking the blood vessels that feed them. And you've heard of uterine fibroid embolization. And this is kind of technique that is used to block the vessels that feed them, and they literally melt away. and with very good effectiveness.
All right. If anybody is concerned that, because you've talked about surgery and you've talked about the target area here is very sensitive for the group that you're talking about, the women of childbearing age, yes. Somebody is concerned about whether this treatment could have any impact on their chances of their fertility or their future plans to have another child. Talk to that person about, you know, the risk factors that are involved and what you do as a specialist to ensure that you really take care of that concern when you're conducting this.
Absolutely, absolutely. I think that is an important concern because, as I said, fibroids need only be treated when they are causing symptoms. Sometimes one suspects that the symptoms that fibroids are causing is difficulty in getting pregnant, especially if they are located in the areas that I talked about earlier. So however much one may be afraid of the effects of removing the fibroids on their fertility, if they are causing the problem, they really have to be removed for the problem to be solved. So if there are fibroids and one has checked and cannot find any other cause of infertility, it may be just as well, as I've alluded to earlier on, that by removing the fibroids, and I've actually even currently patients in whom, I have one patient in whom probably, that was in November last year, she was planning to have her fibroids removed so that she can go for IVF. Mm-hmm. And we did a laparoscopic myomectomy in our hospital, and she's now carrying her pregnancy. Mm-hmm. Yeah, and very much, by the way. So, so sometimes the fibroids can be the problem in getting pregnant. But if you go to your physician, he should be able to advise you whether, because even removing fibroids bears a risk, like any other surgery. Mm-hmm. Because there is a risk that in the recovery process, after removal of the fibroid, one could get an infection, or you could get what we call adhesions. You know, that's different parts of the organ sticking together unnecessarily. And this can complicate an otherwise normal pelvis. So the surgeon has to be careful to avoid this kind of complications. But as I said, if the fibroids are the cause of the infertility, really you have to remove them. There is no choice. Yeah.
Other way.
There is no
All right. We have very few minutes left, but yes. I want us to sample some few questions and feedback from our viewers very quickly so that Dr. you can respond to them before we wrap this up. Remember, we invited your feedback on social media, on SMS 22422, and on social media at Citizen TV Kenya, at Safina_Cheng, and at Ayub Abdikadir. And this is what you're saying online. We really appreciate those of you who took time to, send us your views and just ask questions concerning the topic we are talking about this morning on fibroids. And this is on SMS. One is saying, can fibroids make a woman to lose her pregnancy? All right, we've touched on that, but we can still add more. I feel like that needs to be addressed. I have experienced a lot of pain in my breast for almost 2 years. I have visited many hospitals, but hawajawai pata the cause of this pain. What can I do? All right, we have that. One is saying, how is stress related to fibroids? Good question. Yeah. We have one saying, what is the percentage of older women in their late 40s likely to get fibroids? All right. We have one, what if your period comes every day like it does not stop, a month ends? What is the problem? All right. My sister had fibroids on the uterus and succumbed during removal. Doctors didn't explain the cause. Okay. All right, that's an unfortunate one. But yeah, Dr. I want you to respond to a few that have been sent here. The first one, can fibroids cause one to lose the pregnancy? I think you had...
Yes, I did mention, yes, that occasionally you may find fibroids, if they're located in the lower part of the womb, or sometimes if they're large and are indenting into the inner part of the womb, that those fibroids can actually lead to miscarriages. And sometimes even if they are not located in those areas, and they're just in the muscle of the womb, because of the changes that they cause in terms of the blood flow to the womb, also in terms of the inflammation or the reaction that occurs around the fibroid, around that area, that this can lead to both failure to get pregnant and also to miscarriages.
All right. I'll run you very fast because of time.
Yes.
We have one who is asking, how is fibroids related to stress?
It's a good question.
And, good question.
Yeah.
And also one asking, the chances women in their 40s, how are they at risk, and what are the chances that they can also get fibroids?
Yes, let me begin with the latter one. Women within their reproductive age group are at a higher risk of getting fibroids. And as I said earlier on, the prevalence of fibroids in the African population in the reproductive age group is about 30%, thereabout, 25 to 30%. So yes, women at 40 are at risk, and especially if they have family members who have fibroids. Yes, that is possible. But the older you get, the less likely it will be that fibroids will just suddenly appear at the age 45 and on if you have not seen them in earlier age. The question about stress is important, and I think let me put it this way. We alluded to this earlier on by saying that if stress affects the quality of your blood, if stress affects your immunity, then as we said from the cause of fibroids, the postulated causes of fibroids, it can contribute to the growth of fibroids, especially if that stress is also related with obesity, which very often the two are related. So stress indirectly, let me not say directly, if it affects your immunity, if it affects the quality of your blood, may contribute to the causation of fibroids.
Why should you encourage stress anyway? I mean, deal with it.
Yes.
That can actually not just cause fibroids, it can cause so many other things in your life. So just try and live a better life, manage your stress levels, and you will be able to have a quality life. Let's talk about periods every day, like every day of the month. And this woman is wondering, what is the problem?
Fibroids could be, but there could also be other causes of heavy bleeding, and one needs to have that checked up, because fibroids can be, especially if those fibroids, as we alluded to earlier on, are located close to the inner lining of the uterus where the shedding of periods happens. Those can contribute to periods occurring very frequently during the month. But the majority of women who have fibroids will have heavy, prolonged periods, but that are occurring cyclically. So a period that is lasting more than 7 days and a change of pads that is more than usual may indicate fibroids. But there could also be other causes of this kind of bleeding.
All right. A patient who passed away during treatment?
Oh, that's a very important. Any surgical procedure is attended to by risks. And one must weigh the risks, and your physician must explain to you clearly and candidly the risks of any surgical procedure that you go for, particularly when it is a major surgery, including the removal of fibroids. But the cause, there are several causes of possible causes of death during removal of fibroids. The majority of them is just because of the bleeding. The bleeding can be excessive. There are mechanisms of managing that bleeding during removal of fibroids. Laparoscopic surgery is one of the mechanisms of reducing bleeding during removal of fibroids, but that can be managed. But any death that occurs on a planned surgery must be investigated for the purposes of learning and not avoiding the same mistake.
Thank you so much.
Thank you very much.
I wish we had more time for this conversation, but that's the much we've been able to cover until now. Join us next week, another topic, and you will learn so much about living a healthy life. I've been hosting this morning Dr. Buckley Onyambu, a consultant obstetrician and gynecologist, also a laparoscopic surgeon, who was sharing with us his insights on fibroids, how to manage the risk factors, treatment options, and what you need to do in case you suspect that this could be a condition that you're battling with. My name is Safina Chengoma. Have a lovely day ahead and enjoy the rest of your viewing.
Thank you.